Hello, I know the title of our meeting today may have caught your attention, perhaps even with a hint of concern. What happens if I go without ejaculating for a long time? It's a question that many men, especially after the age of 60, ask themselves in silence, sometimes with a certain amount of anguish. Maybe you've typed this very phrase into a search engine late at night, looking for a straight answer. The internet, with its multitude of voices, probably gave you a mix of alarm and magical solutions. But I want to propose a different conversation. I want to suggest that perhaps this isn't the most important question. The real point, the one that is rarely discussed with the depth it deserves, is not about an expiration date or an imminent danger lurking in abstinence. It's about how we can intelligently and serenely take care of the health of your prostate, your pelvic circulation, and your overall well-being, regardless of how frequently you do or do not have an ejaculation. It's about understanding the mechanics of your body to keep it running smoothly, like a well-maintained classic engine. Allow me to introduce myself. I am Dr. Emily Carter. I am a medical doctor from Johns Hopkins University, where I also completed my residency and doctorate in urology. Throughout my career, I have sought to delve deeper into what we call sexual medicine and andrology, the field dedicated to men's health. I had the opportunity to study in Germany, in Freiburg and Berlin, focusing my research efforts on something that seems complex but is fundamental to your health: pelvic microcirculation and vascular health. For over 15 years, the focus of my work in the clinic has been helping men, especially men like you who are over 60, navigate this phase of life with quality, science-based information translated into practical, myth-free terms. My goal is to lift the weight of misinformation and anxiety from your shoulders and replace it with knowledge and autonomy. And I want you to know one thing from the start. If you have these doubts, if you feel any insecurity about your body, it is not your fault. It's a matter of physiology and habits that often no one ever taught us to cultivate. Let's get to the point, to what almost no one tells you. The discussion about ejaculatory frequency often gets lost in numbers. You may have read that ejaculating X times a week could reduce the risk of some disease. The conversation turns into a kind of target, a magic number that, if not reached, generates more anxiety. But the most important detail, the real secret to the health of your pelvis, is not in the number, but in the quality of your blood circulation and the tone of your pelvic muscles. Think of your pelvic region as a garden. Ejaculation would be like harvesting the fruit. It's part of the process, no doubt. But for that garden to be healthy, it needs two essential things: good irrigation, which is oxygen-rich blood reaching every corner, and loose, aerated soil, which would be your relaxed, tension-free pelvic muscles. Many men over the years develop a kind of chronic tension in this region, an invisible clamp on the pelvic floor which compresses vessels and nerves. And then that feeling of heaviness, of congestion arises, a discomfort that isn't quite a pain, but it's always there. What few people know is that it is perfectly possible to promote a natural cleansing and healthy blood flow in this region with techniques that go far beyond ejaculation itself. We can use tools you already possess, like your breath and the way you move your body, to keep this internal garden well tended. But why can this work? Let's understand the physiology simply. Your prostate is a small gland, the size of a walnut, and one of its functions is to produce part of the fluid that makes up semen, and it does this continuously. Ejaculation is indeed one of the ways to expel and renew this fluid. In theory, this can help prevent the buildup of old secretions and substances that, over time, could become problematic. It is a cleansing mechanism, yes. However, the health of the prostate and all the surrounding tissues depends fundamentally on blood flow. Blood is what carries oxygen and nutrients and what removes cellular toxins. When circulation is good, the tissue is healthy, resilient. Think of a sponge. If it becomes dry and compressed, it gets hard and brittle. If it's well hydrated and fluffy, it's flexible and functional. The same principle applies to your pelvis. Furthermore, the relaxation of the pelvic floor is crucial. Tense muscles squeeze the blood vessels, like stepping on a hose, and can compress nerves, causing discomfort and even affecting urinary function. Therefore, any technique that improves circulation and reduces this chronic muscle tension tends to be as important or more so for your local well-being than fixating only on the frequency with which you ejaculate. The focus shifts from the result to the maintenance of the system. The good news is that taking care of this system doesn't require anything complicated or expensive. We can build a set of habits, what I like to call a habit stack, where one simple practice adds to another, creating a powerful effect over time. Let's start with the first layer, the most fundamental of all, diaphragmatic breathing. What is it? It's simply breathing using the full capacity of your diaphragm, the large muscle below your lungs. Sitting comfortably or lying on your back, place one hand on your chest and the other on your abdomen. Inhale slowly through your nose and feel the hand on your abdomen rise, while the hand on your chest moves very little. Your abdomen expands like a balloon, then exhale slowly through your mouth, feeling your belly deflate. Why can this help? This up and down movement of the diaphragm acts as a gentle massage for your internal organs, including the bladder and prostate. More importantly, it sends a signal to your nervous system to relax, and this relaxation extends to your pelvic floor, relieving that chronic tension I mentioned. How can you start today? It's very simple. Do 5 complete cycles of this breathing in the morning before you even get out of bed, and another 5 at night once you're in bed ready to sleep. The only caution is to breathe comfortably, without forcing, without trying to fill your lungs to their limit, just a smooth, deep rhythm. After a few days of practicing your breathing, we can add the second layer, conscious walking. I'm not talking about a marathon, but a simple walk, paying attention to your body. What is it? It's walking at a moderate pace, feeling the movement of your legs, the swing of your hips, and the contact of your feet with the ground. Why can this be so helpful for your pelvic health? The alternating movement of your legs when you walk acts as a natural muscle pump for circulation in the pelvis. Each step helps push venous blood back toward the heart, preventing it from pooling in the pelvic region. This improves venous return and, consequently, the arrival of new oxygenated blood to the tissues of the prostate and surrounding areas. How to start today? It's as simple as breathing. After lunch, instead of sitting down immediately, take a 10-minute walk. It doesn't need to be fast, just steady. The environment doesn't matter. It can be on the street, in a park, or even indoors. The caution here is to wear comfortable shoes and always respect your body's limits, especially if you have any joint issues in your hips, knees, or ankles. The goal is movement, not exhaustion. Now for the third layer of our habit stack, which integrates perfectly with the other two, warm hydration. What is this? Simply starting your day by drinking a glass of warm water or a mild, unsweetened herbal tea. Why are temperature and hydration important? Good overall hydration tends to keep all bodily fluids, including prostatic fluid, more fluid and less thick. This, in theory, can facilitate its natural renewal, preventing it from becoming too dense and stagnant. The warm temperature, in turn, has a relaxing effect on smooth muscles, like those in your urinary tract and around the prostate. It's no wonder a hot bath is relaxing. The same principle can be applied internally, gently. How to start? Tomorrow morning, swap the first glass of cold water of the day for a glass of room temperature or slightly warmed water, like a tea. The most important caution here is for men who have any fluid restrictions due to kidney or heart conditions. In those cases, the guidance of your cardiologist or nephrologist must always be strictly followed. Of course, I know what you might be thinking. But doctor, what about the story that not ejaculating increases the risk of prostate cancer? This is one of the biggest sources of anxiety, and we need to talk about it honestly. The truth is, the scientific evidence on this is not conclusive. There are some studies called observational studies that have suggested an association between higher ejaculatory frequency and a slightly lower risk of developing prostate cancer. However, association does not mean cause and effect. It could be that men with higher ejaculatory frequency simply have other healthier lifestyle habits, for example. No study has been able to prove that the act of ejaculating by itself is the definitive protective factor. Therefore, instead of fixating on ejaculating X times to prevent cancer, the safest and most scientifically backed approach is to focus on the risk factors that are proven to be modifiable. What are they? Maintaining a healthy weight, having a balanced diet rich in vegetables like tomatoes and broccoli, and low in saturated animal fats, and, of course, getting regular physical activity, like our conscious walk. Ejaculatory frequency, if it plays any role, comes in as a supporting factor and is by no means determinate. What you put on your plate and how you move your body every day is far more important. Another common objection is the fear of losing function. If I go too long without using it, will I rust and no longer work? This is a valid concern, but one that also needs to be demystified. The mechanism of an erection is, in essence, a hydraulic and neurological event. It depends on a stimulus that triggers the release of a key substance called nitric oxide in the walls of your blood vessels. This nitric oxide relaxes the vessels, allowing blood to flow in and fill the corpora cavernosa of the penis. Therefore, the health of your erectile function is directly linked to the health of your vascular system, your plumbing. Prolonged abstinence does not cause physical damage or permanent atrophy. What can happen is a decrease in the repertoire of stimuli or certain psychological insecurity. But the key to maintaining function is, and always will be, taking care of your cardiovascular health, controlling blood pressure, cholesterol, blood sugar, and keeping your arteries clear. The breathing and walking we discussed are excellent for this. And finally, the practical question. I don't have a partner, what do I do? It is fundamental to understand that your pelvic health and your well-being do not depend on having a partnership. Taking care of yourself is an act of self-respect. Masturbation is a perfectly natural and healthy way to maintain ejaculatory function if you so desire and to connect with your own body. But as we've seen, the health of your pelvis goes beyond that. The layers of our habit stack, diaphragmatic breathing and conscious walking, are even more fundamental because they work at the base of the system, improving circulation and relaxation. And these are practices that any man can do at any time, anywhere, alone. They give you the power to actively care for your urological health every day. Over my years in practice, I've seen how this shift in focus can be transformative. I remember Mr. Davis, a 72-year-old retired engineer, a widower for several years. He came to my office very anxious, not because of a lack of desire, but because he no longer had an active sex life and had read on the internet that this could cause him serious problems. He complained of a constant feeling of heaviness in his perineum, the area between the scrotum and the anus. Instead of focusing on ejaculation, we started with the basics, breathing exercises and daily walks. In about a month, he returned, reporting that the uncomfortable feeling of heaviness had drastically decreased. He told me, "Doctor, I feel lighter and best of all, calmer, knowing I'm doing something good for myself even without having sex." Another case that struck me was that of Robert, 68, whose wife was undergoing a delicate health treatment, which naturally put the couple's intimate life on hold. He felt guilty and worried about his own health. We focused on warm hydration in the morning and light pelvic stretches combined with breathing. To his surprise, he noticed that his nightly trips to the bathroom, which used to be 3 or 4 a night, decreased to 1 or 2. He felt more in control of his body and his well-being, which relieved a huge part of his emotional burden. It's important to be transparent about the limits of what we know. The physiology of the production and renewal of prostatic fluids is well understood. The benefits of physical activity, hydration, and pelvic floor relaxation for general urological health are based on very solid medical principles. However, the exact relationship between a specific ejaculatory frequency and disease prevention is still a topic of debate in the scientific community. The results of the practices I've suggested may vary from man to man because each body is a unique universe. Therefore, please view our dialogue as educational content, a new perspective for taking care of yourself, but one that never replaces a complete and individualized medical evaluation. Imagine starting to apply this gently. Tonight, before you sleep, already in bed, try those 5 cycles of abdominal breathing. Feel the air come in, your belly rise, and as you exhale, imagine all the tension in your pelvis dissolving. Tomorrow morning, upon waking, repeat the 5 breaths and then prepare a glass of warm water or chamomile tea and drink it calmly before your coffee. After your lunch, take 10 minutes for that conscious walk. It's not about performance, it's about presence. Feel your muscles working, your circulation activating. In a few days, you might notice a greater sense of relaxation in the pelvic region. Within a few weeks of consistency, some men report, like Robert, an improvement in urinary frequency, or like Mr. Davis, a relief from that feeling of heaviness. It's a process of reconnecting with your body. As you build these new habits, be careful not to fall into some traps that can sabotage your efforts. The first mistake is thinking you need to ejaculate in a hurry, or mechanically just to meet a target you read somewhere. This creates stress, which tenses the pelvic floor, the exact opposite of what we want. Another common mistake is sitting for too long, whether working, watching TV, or in the car. This compresses the prostate and hinders circulation. Get up every hour, if only for a minute. Ignoring the urge to urinate is also harmful, as it overloads the bladder and pelvis. And, as we've discussed, drinking too little water makes bodily fluids thicker. Finally, the most subtle and perhaps most damaging mistake: confusing the absence of ejaculation with the end of your sex life or your masculinity. Your health, your vigor, and your identity are much broader and richer than that. To conclude our conversation, and this is the most important part, I must leave some very clear safety warnings. It is absolutely essential that you see a urologist if the absence of ejaculation is accompanied by other symptoms. Pay attention to your body's warning signs. Seek medical help if you have persistent pelvic pain, difficulty or pain when urinating, if you notice blood in your urine or semen, or if you experience a sudden and unexplained loss of erectile function. Symptoms like fever or chills associated with pelvic discomfort also require immediate medical evaluation. Please do not assume that any discomfort is simply normal for your age or a consequence of abstinence. Your body communicates with you, and you need to listen to it. I hope our conversation has shed a new light on this topic, an approach more focused on health and less on anxiety. What did you think? Did it make sense to you? If so, please comment below with the number 1. If not, if you still have questions, comment with the number 0. Your opinion is important, and if you think this video could help a friend, a brother, or an acquaintance over 60, please share it with them. Sometimes a frank and taboo-free conversation is the first step toward a healthier and more peaceful life. Remember, the goal is consistency, not intensity. It's about caring for your body with kindness and wisdom. Your body has an incredible memory and knows how to respond to good care. Take care of yourself with autonomy and dignity.